Last week, the Environmental Protection Agency and the Biden administration announced the first national limit to PFAS, or forever chemicals, in our drinking water. So we want to bring in Dr. Bryan Staley from the national nonprofit Environment and Education Foundation. Dr. Staley, good morning to you.
Good morning, Marissa. How are you?
I am great. Let's begin with the newest legislation, but also what PFAS are.
Sure. These are man-made chemicals, per and polyfluoroalkyl alkyl substances. Better to say forever chemicals. It rolls off the tongue easier. But these are in hundreds of consumer products, including dental floss, food packaging, and even toilet paper. And so they're everywhere and even been detected on both poles on the globe.
It's so interesting you mentioned that, because I always think of just drinking water, but pizza boxes, takeout containers, they're really in almost everything. Talk about the limits that will be placed.
Sure. So the EPA, as of the thousands of PFAS compounds that are out there, this particular legislation focuses on 6. Two of the legacy compounds that are designated PFOA and PFOS have limits of 4 parts per trillion in drinking water. So it certainly is a way to help reduce exposure to those potential detrimental health effects we all may experience from PFAS.
What are those health effects, and why are they dangerous or can be potentially?
They can be, and many of the studies that have been done at much higher concentrations. And so what those studies have suggested is that cancer, particularly kidney cancer and testicular cancer, are of particular concern. But there are other types of problems like developmental effects and reproductive effects that can potentially be a concern when we're exposed to PFAS.
I read also that it can impact the immune system and your ability to fight off and ward off diseases. So my next question, and I don't know if you can answer this, Dr. Staley, why did it take so long to get these limits in place?
Well, in many respects, there has been debate around the public health aspect of things. How concerning are these particular compounds? In many respects, one could say this legislation is really a Band-Aid, because the exposure that we get as humans, really drinking water is one of 3 primary sources. We also get exposure from inhalation as well as ingestion. So there's a lot of work still to be done.
And where can people go to stay connected to you as well as your nonprofit? I know that you all do a lot of work in this space and are continuing to do so.
Right. A lot of our work is focusing on controlling PFAS in the downstream infrastructure that's designed to protect human health and the environment. And you can find us at www.erefdn.org.
All right. Well, thank you so much, Dr. Bryan Staley from the national nonprofit Environmental and Education Foundation. We appreciate it.